Welcome back, America, to the Eli Loew 2040 presidential campaign. It's day 25 in the bunker, and we're running out of food and toilet paper. We're preparing our defenses and our attack strategy to go out into the hordes of zombies, blocking us from more food, more toilet paper. Hang on, sorry, something doesn't sound right here. Guys, this is the wrong script. Wrong apocalypse. Get me the right one here. Thank you. Sorry about that. Day 25, home isolation, plenty of food, plenty of toilet paper, working from home, family always around, spending more time with the wife and kids. Actually, things aren't going that bad. But that's for me. I know for a lot of Americans, life is really difficult right now. Not to mention the stress of everything going on around us, and more importantly, the uncertainty of what the future will hold. And I think this is a time for true leadership, a time when a no name presidential candidate might be able to step up and offer a real solution. Because there has been no real plan. People are trying their best, no criticism, but people need a plan. It reminds me of a famous line from a famous movie, Scary Movie 4, where the father says to the son, or the son says to the father, I have a dream. And the father says to the son, what is your dream? And the son says, to have a dream. And that's a very powerful line, and I feel like that's what's happening now. And we're asking our politicians, what is the plan? And the answer is, to have a plan. And I get that, right? Because everyone's scared to propose a plan when there's not enough data, when there's not enough information. And then if their plan is a dumb plan, it could destroy their political career. Lucky for me, I don't have a political career, and I'm a nobody on the internet, so I'm very happy to propose a very solid plan. Now, one caveat, this plan is only for the elite. Sorry, plebs. But yeah, requires a certain amount of education, a certain amount of intelligence. And I will say that, I'm kind of an Elon Musk super genius stage 2, or maybe, a 19-year-old big brain type of genius. And for those that didn't get those references, links are in the description. Yeah, it's if you're a politician, if you kind of work as a head of industry or head of the media, or even if you're a local politician that's making decisions that affect the day-to-day outcomes, then this video is not for you. Be a little bit over your head. Go find someone with a STEM degree, have them watch this video, and then kind of do whatever they tell you. So, now that we just have the elites in the room, let's get started. I'm sure everyone's seen this graph. Very pretty, right? Very good for enforcing, social compliance, soften the curve. Actually, mostly accurate, no complaints, but way oversimplified, right? And, if you know math, you know that there's way too much going on to put it into two graphs. And so, let me give a little background. I've kind of tried to deep dive into this a bit because I think this is important. And I haven't really seen this explained so well. But what you have here is a worst case scenario graph, right? So let's take that real tall graph, and I'll try to break this down for you guys quickly. I'm sure you love my artwork here. But basically, with the worst case scenario graph, and this would never happen because people aren't that stupid. They'll always adjust when things get bad. But in a worst case scenario graph, and all these numbers are hypothetical, this blue line obviously represents the number of cases, not deaths, just to be very clear. Cases, total cases, actual cases, so not measured cases, not cases that have been tested, but the real number. And this red line represents medical capacity, right? And when you have this kind of virus that spreads so quickly and sends so many people in need of medical attention, then what you end up having is tiered death rates. And what that means, these green numbers represent death rates, is you have, if everyone within the medical capacity would have whatever the true death rate is, right? Then, as you go each tier above the actual medical capacity, the death rate increases. And it increases, again, can be exponentially, can be linearly. We don't really know, and so these are just fake numbers. But the point here is the difference between having a death rate within medical capacity and having a death rate at the way extreme edges of medical capacity is massive, right? And just in the examples I gave here, they're kind of reflective of what we're seeing in, let's say, some of the cities in northern Italy, right? The other important point here is in a worst case scenario, if you have no mitigating factors, you have a very heavy downward slope for the loss of medical capacity. Because as all this happens in a very fast time period, there's no time to recover, your staff gets sick, and so they're also out. The ones who are left become more and more overworked, as well as kind of the emotional, physical drain. And there's no time to improve the situation. There's no time to build new hospitals because everyone who would be involved in that process is either getting sick or completely focused on helping people survive. And so you just have this crazy downward curve of medical capacity. So that even on the other end of your extreme case, as you get back to similar numbers you had on the up curve, you actually have more deaths. Right? So here you can see that this many people at the beginning would have a small death rate, but the same number of people might have tripled the death rate. Now this curve, and because people are bad at perspective, I have to say this could apply to a single town, a village, it could apply to an entire country, it could be the whole world. The other thing I tried to make representative is that in a worst case scenario, you're probably looking at kind of a third. Like if the area of the sheet of paper is a population, then the worst case scenario might take a third of that population in a very short time period. Could be more, could be less. Again, this is all speculation because we don't have numbers. But this is important to kind of give the background to my plan. It's also important to understand why what we're doing right now is absolutely correct. So I see a lot of crazy people coming up with all these theories. Some people still saying it's just like the flu. Other people saying, why am I responsible if, other people are getting sick? And it's a hard concept for people to grasp. The reason is, and I want to emphasize this, even if the death rate down here is the same as the flu, 0.1%, because it spreads so quickly and we don't have capacity to handle it, the flu is 0.1% with medical help. Right? When people get the flu and it's really bad, they can go to the hospital, they can have their fever brought down, they can have mitigating effects, medication, they can get on ventilators, whatever they need to help them survive, right? And the current medical system really does its best to save every life, and so you have a low death rate for the flu, right? If the flu spread this fast, right? And I'm saying even if the death rate is the exact same as the flu, you're still going to get a massive increase of death, because of our lack of preparation, right? Because of how fast it spreads, how little time we've had, how the fact that we have no vaccinations, no known kind of medical mitigation drugs or anything like that. It's all too fast, too soon. So please respect and understand the social distancing requirement, right? Even if you're a hardcore libertarian, this is the public square. This is the perfect example of when government is necessary. We need to flatline the curve, right? And here is then what actually, hopefully, is happening in most countries, and even in most locations outside of kind of the extreme epicenters, is we kind of trying to flatline, right? And where it flatlines determines on at what point in the curve, obviously, we started implementing incredibly strict social distancing guidelines. So here you have a much more simplified graph. The red, again, being medical capacity. But one thing to notice is if you did the cutoff early enough, let's say you did it here, and then 3 weeks later it flatlines here, and your medical capacity is here, then because you're much closer to the medical capacity, that curve doesn't go down at the extreme slope we saw in the other graph. It goes down much more slowly and then recovers, right? Maybe in a place like New York, though, it's up here, and so then the New York curve is going to be a little more painful and kind of come around like this, right? And obviously then your tiered death rate is higher, and so you get kind of an extreme situation. So one thing to point out is that this graph is going to be very localized, right? It's going to be worse in some cities. It's going to be much better in rural areas. There's going to be a lot of variables in at what point were the mitigating factors quick enough, and then where is the medical capacity in those areas, and how much are they impacted by how far above the medical capacity people went. Now, this flat line, it's not really a flat line because there's still cases, because there's people who can't do social distancing or who ignored social distancing, or people who have to work. There's also all your frontline workers, your nurse, your retail staff. So some of them are going to get it. And so there's still an increase. But after that, right, if people are respecting the social distancing, what the majority of people seem to be doing, you'll start to see that curve come down. And then, and this is where we need a plan, then what, right? And this is crucial because you can't just tell people to indefinitely sit on their buns all day, right? What you need some sort of plan, some sort of confidence, some sort of hope, so that people can handle the periods of isolation a lot better. And hence, I present, and I know that the naming probably isn't perfect, probably should have some PR or marketing people jump on this, but what I call the hippity hoppity recovery plan. You can see that, just kind of, I called it that because it kind of looks like a rabbit hopping along, right? And let me jump into details on this because this is very important. So again, let's assume, and I think New York City can't be as optimistic, but let's assume most other places implemented their social distancing early enough, they're sparse enough, people are respecting the guidelines enough that by the time we started to bend the curve, inflect the curve away from the worst case scenario, was at the same point where we kind of reach medical capacity. And of course, if that happens lower, even better, but let's say this is the standard scenario, then you kind of have this area where it's very rough, and then as people recover, we get back up to original capacity, we get more ventilators in, and this actual number of cases come down, where you hit a point where you're kind of back to the capacity you were at before the crisis. And I just threw a number in here, 20%. So then what can you do, right? And this is where I'm estimating this point is probably in most cases 6 weeks, right? Maybe it's 8 weeks. Maybe in large cities like New York City, it's 12 or 16 weeks. It really depends on how this angle works and how much further it comes down. Also in a place like New York City, maybe you can recover capacity fast enough. But at the end of the day, what matters, the most crucial part for this plan is what's hospital capacity. Because once your hospital capacity starts coming down and 6 to 8 weeks have passed, you have this interesting scenario where the hospitals aren't getting overloaded with new cases. Everyone who's most at risk has bunkered down. They can cocoon themselves. They had time to kind of plan and prepare and adjust to having deliveries, to having volunteers help them out. And then you have this weird scenario where you almost need to increase cases again. Because if there's not a cure, if there's not a vaccine, then what you need is you do need some herd immunity, right? You do need people getting it and spreading it a little bit so that this doesn't go on for 2 years, right? And this is where kind of the STEM and health experts kind of need to leave the room, and the psychologists and social science and, I guess we can invite poli-sci people need to come back in, because this is where you're talking about large effects on society. This is where rioting can start. This is where, people just get bored and start doing stupid things. And so you need this plan, I'd say after 6 to 8 weeks, purely measuring hospital capacity, and with much improved testing, and with a very clear understanding that all high-risk individuals have to protect themselves and cocoon themselves away from society, you can start bringing in incrementally 10% of society. So you have the people between 20 and 30. You allow self-employed businesses to reopen, keeping in place strict social distancing measures, because what you want to see is you still want the disease to spread slowly, but you want it to spread slowly as people are active and interacting with each other. And what you measure then is how much that starts to impact hospital capacity. So it's going to be different in every hospital. It's actually the hospitals that should be making the decisions here on what their capacity is and whether it's gone back down to normal levels. If they have a lot of nurses and doctors out sick and they want to wait till they recover, that's something that they should make the call on. But with the clear goal here to start bringing people back, right? And I think this is the kind of plan that I hope we eventually end up going to, because you can kind of test and learn and see. And then maybe around here, you start introducing back schools. You start with universities and then middle and elementary schools and kind of work your way around. Obviously people who can work from home and who have that benefit should keep doing that, right? There's no reason for them to kind of go out and continue risking, but a lessening of the restrictions with the intention of creating kind of a firewall of younger, healthier people who get the disease and recover quickly. Now, that being said, we can't be naive. There is always risk. Death is a constant. In the United States, people are always, there's always a high school, college student that tragically just perfectly healthy, has some kind of heart condition right on the practice field, and passes away. So we would never guarantee that no one will die. It's just something that is part of life. It's a painful part of life. And I would strongly recommend watching a kind of libertarian theme song called People Will Die. But it has a very beautiful line in it which says, why don't we empathize with each other and weigh the costs and the benefits, right? Because this kind of mantra of as long as it will save one life is not a good mantra. And if you hear that, you're definitely hearing someone who does not know what they're talking about, because we can never know what will save one life. If you get that granular, any action you take just to take one life could end up killing 2 or 3 lives. And I don't mean that for the current self-isolation. Again, I need to emphasize that because everyone's really sensitive about it. This is the right plan right now for at least a 6 to 8 week window, absolutely necessary. But then we should be looking at incremental reintroduction of people. They can take the risk themselves. The people who are most at risk can protect themselves now that they've had some time, now that we have more numbers. For this plan to work, there are kind of 3 metrics, that we really need to get on top of. And I wouldn't feel comfortable going back out into society unless I was very confident about these. And I think this is something where the government really needs to prioritize. Hospital capacity, right? What is the actual hospital capacity? How do we measure that? The hospitals need to be in charge of that, but they need a lot of help because they're going to be busy. And then testing of existing cases. So as soon as you start having symptoms, you should easily be able to get tested. If you're tested positive, you actually should stop spreading it. You should try to get quarantined. Everyone who knew you should also get tested then and get quarantined. Because again, even if we're reintroducing people back to society, we want them to slow the spread, right? Because with the goal of slowly introducing everyone back to society and having this kind of practice and societal rigor in place, then we really want to be testing people who have the antibody in their system. I wrote antibiotic the first time. I think that's wrong because you can't use antibodies for a viral infection, but people can build up their own antibodies. And if that's wrong, again, I'm not an expert, but the point is people who've gotten it should in theory be immune. And so even though you don't have symptoms anymore, if you thought you might have in this earlier time when things were too crazy, you should then 6 to 8 weeks after the initial lockdown be able to get yourself tested. If you have the antibodies in your system, then you're also part of that firewall for the rest of society. You can go back out in society. You should be okay. If you get similar symptoms again, you should immediately be tested because that brings up another scary issue about whether this virus is mutating and whether we actually can build up antibodies to it. So that's my plan. I offer it out to the general public as a nobody on the internet, like so many others. But I think it's a good plan, if I do say so myself. And that's because I haven't heard anyone talking about any kind of coherent, kind of incremental strategy. I think politicians and experts actually have a hard time thinking incrementally because certain experts will think exponentially. And that's where the stem cell guys might need a little help from, social science and psychology, although, they're not even close in terms of their skill set. So let's not pretend. And so at the end of the day, I'm not an expert and I know that. But at the end of the day, we need some kind of plan. right? And the current kind of status quo will drive people crazy. It will create riots. It will create unrest. When people get bored and really stressed, it's going to cause a lot of bad behavior, right? And I think that's something that everyone should just be aware of. We know it's coming, but if we have a plan, that really helps mitigate those effects, right? People can have confidence that things will change. They can see a little bit of hope into the future. And if we have very good metrics to help drive that plan, then we should be in a really good situation, right? For most people. I know there's always going to be a lot of tragedy. I don't want to downplay that. For those of you that are suffering, everyone in America is really trying to help you right now. They really care about you in the kind of non-personal sense. Of course, everyone who does know you really does care about you and hope that can give you encouragement. But, we're in this together. And in this case, not just America, but the whole world. And I think it's a time where we can also improve our ability to empathize and really try to take care of each other more than we ever have before. And I think that is what 99% of people are feeling right now. And I think that's a good thing for all of us. Please take care of yourself, take care of your mental health, take care of other people that are in your life as best you can. And I look forward to seeing everyone on the other side of this. So, thank you, America, for listening. Stay healthy, stay safe, and we'll see you soon.